Greetings and salutations. I'm Kyle Pinion, Director of Public Policy and Advocacy for the National Multiple Sclerosis Society Georgia Chapter, and this is your Video Action Alert. The Georgia legislative session was a flurry of activity this year as lobbyists and advocates alike worked to make sure legislation that was important to them saw secure passage. While most of the debate over this extra-long session involved Georgia's nearly $2 billion budget shortfall, there were some very important bills that were heard that would impact the MS community. 7 bills the Georgia chapter had a direct hand in advocating for passed through sine die the final day of the legislative session. Here are our list of those bills. House Bill 1040, which amends the Nurse Practice Act to allow unlicensed trained caregivers the ability to perform certain health maintenance activities in the home under the written order of a physician. House Bill 866, which allows the State Medical Education Board to make grants to rural area hospitals to attract new physicians into these underserved regions. Senate Bill 316, which allows Medicare Supplemental, or Medigap, insurance plans to be sold to all Medicare recipients and not just those over the age of 65. House Bill 1393, a bill that will allow for a 1-cent sales tax referendum in Clayton County to go towards funding for the currently out-of-service C-Tran public transit system. House Bill 277, which will enact comprehensive transportation reform throughout the state, providing more accessible mass transit options for the state's rural regions. House Bill 321, which will include third-party insurance administrators under Georgia's prompt pay statutes, making sure that our physicians get paid on time for services rendered. And finally, House Bill 1272, which creates an MS Research Fund tax checkoff on individual tax forms here in the state of Georgia. It has been another exciting and progressive year for MS activists, and we look forward to the significant changes for many in the MS community that implementation of these new laws will bring. And now, your action alert for this month. U.S. House Resolution 1362 will allow for the creation of an MS and Parkinson's disease registry. This is a national coordinated pilot program that will allow the research community and the society the ability to ascertain the true incidence and prevalence rate for MS nationwide in a manner that completely protects patient privacy. The National MS Society estimates that around 400,000 people are living with MS nationwide, but it is impossible and difficult to know the total number without a permanent national system. Here is more info about the bill. An accurate assessment is necessary to better understand the MS population in the United States. While several small and uncoordinated MS registries and databases exist in the United States, one national harmonized data collection system does not exist to provide an accurate national overview. In fiscal year 2006, the Agency on Toxic Substances and Disease Registries, ATSDR, moved forward to develop a strategic plan for a national data collection system on MS that would provide these much-needed incidence and prevalence estimates. It is anticipated that a national registry will involve mining several data sources and health information systems linked electronically. This bill is beneficial not only to the research community in funding more accurate research projects, but also to the society in terms of program planning, gauging the needs of the MS community, and our advocacy efforts. Currently, a great number of Georgia's delegates in Congress have signed on in support. If you see your member of Congress listed here, call them at 202-224-3121 and thank them for their support. Or if they have not signed on, please call and urge that they do so by calling 202-224-3121 and ask that they sign on as co-sponsors for this all-too-important legislation. For the National Multiple Sclerosis Society Georgia Chapter, I'm Kyle Pinion. We are your eyes and ears at the Capitol for a world free of MS.